Now, the findings that we observe are really in two basic categories. Remember, we're not looking for any one particular diagnosis. We're just looking for where are the areas that are underactive, where are the areas that are overactive. And as it turns out in our clinical experience, 90% of patients basically show both of these things. So the question really becomes, what's the more predominant factor? Is it an overactivity or underactivity? And then based upon that, what kind of helpful therapy judgments could we make? One of the recommendations, get a SPECT scan on your child only if the imaging site actually does brain SPECT scans. They actually have done a couple of dozen cases, so they clearly have some clinical experience. They know how to sedate the child safely in case that's necessary. And when they look at the scan, they're interpreting the scan in terms of the clinical context was, what does this mean for the individual who's in the autism spectrum, or the individual who's had a traumatic brain injury, or the individual who's in the older age individuals where the question is about dementia or stroke. These have to be interpreted in the appropriate clinical context. So bottom line is we do have modern medical imaging technology that's not experimental. We can actually use that to look at and characterize brain areas that are underfunctioning or overfunctioning. We can tell you about the magnitude of that process. We can also give you some clue about what that means clinically so as to guide you into terms of what's the next most appropriate therapy. So these are the last points. Number one, how can we ease the stress? And it's not just of the individual. I know all the families are stressed like heck. When I talk with parents, I say, I get that, like for you, this is 28 hours a day and 8 or 9 days a week to be with someone who has a typical brain function. So we can help to ease some of the stress and the burden, because if we uncover a seizure focus, that can be treated. We can uncover areas of traumatic brain injury. Your children are not necessarily traumatized, but the reality is a lot of them do some head banging. The brain is very soft. It's easy to injure it. There's some unknown traumatic brain injury factors. We can help you find improved temporal lobe function, which may result in some improved languaging. The cerebellum at the back of the brain has 50% of the cells in your brain. It's important to have that functioning appropriately for sensory integration. We can uncover anxiety areas. And I see the person coming with the hook. So then this is the last point, is it? So we can discover areas that would help you to understand why this function looks like there's some attention deficit disorder, but it's really cognitive inflexibility because another part of the brain is actually overactive. We can help you find, just areas that are not responding to present therapy. And in fact, when would you use a scan? Bottom line is, you said, this is not a screening procedure. So when you're going to use the scan, my recommendations basically are when a person has gone through whatever form of therapy they have been, and you've been on that pathway for a while, whether this is stroke management or autism, what have you. If you've been on that pathway for months, hopefully not for years, and things aren't changing, could be time to actually look to see what the brain is doing and what that tells you is the next best step. Second time to use a scan is that, well, we've already done something. Let's say this is before a course of hyperbaric oxygen therapy, which could take the better part of 2 months. You might want to have a baseline scan to look at what's all being treated, such that whatever you subsequently do, you've got a baseline study to say, at this moment in time, on this scan, we knew that these areas of the brain were doing whatever they were doing. And if you did a subsequent scan, we could see if things changed, improved, or if you need to modify the therapy that you're using. So this was a quick overview, but I do want to thank you for using your brain function. If you want to know more about our services, nlbrainhealth.com, because we're actively involved not just in autism, but helping people with chronic fatigue. We know that in family members, there's the elements of stress, mood dysregulation, chronic fatigue. We can help people in addition to those who are just in the autism spectrum. We can help you with various other behavioral medicine disorders. We even have a new form of depression therapy that time doesn't permit us to describe right now. But Dr. Henderson is here, and we're open to questions. We're in the booth over here. We would like you to know that you really can take a look to see how brains are working, including your brains, and get yourself some direct, objective information about what's the next best thing to do to understand this situation. I thank you for using your brain.